this is my audience. Let's get started. Diabetes, it's a thing. There's type 1, there's type 2. Is it because you eat too much cake, or is it because ice cream is your favorite food, or do you struggle with weight issues? In all honesty, there's a lot more complexity to the disease. Many people have a family member, a friend, or maybe you even struggle with diabetes. It's really important and useful information to recognize signs and symptoms of diabetes, as well as to know how to administer insulin if necessary. This speech is aimed towards making you feel comfortable with aiding somebody who has this disease. My name is Shannon, and I'm an employed medication administrator as well as a third-year nursing student. According to the CDC, over 29 million people in the entire world have diabetes. Furthermore, 1 in 4 are unaware that they have this. As an overview, you are going to learn the difference between type 1 and type 2 diabetes. You're going to learn signs and symptoms of low versus high blood sugar, and you're also going to learn how to administer an insulin injection if needed. On our whiteboard, I'm going to show you the difference between type 1 and type 2. So you're aware, insulin is a substance within the body that regulates the body's blood sugar levels. On this Venn diagram, I have the difference between type 1 and type 2. Type 1, the body's immune system destroys insulin-producing cells. The body does this because it believes that the healthy cells are actually foreign invaders. This cannot be prevented. This also often results in low blood sugar, and it's seen between childhood all the way up to young adulthood. Type 2, the body is insulin resistant. The pancreas produces insulin, but the body doesn't use it to its fullest potential. Therefore, the body overcompensates this insulin production, leading to high blood sugar. Silent symptoms are often seen with type 2, meaning people often don't know they have it. This can be delayed or prevented, though, with lifestyle changes. As a whole, diabetes often results in fatigue, increased thirst, increased urination, and weight loss. Now that you have the overview of diabetes as a whole, I want to dive into the difference between low blood sugar and high blood sugar. Hypoglycemia is often known as low blood sugar. This can often be a result of physical exertion, if you miss a meal, or if people miss their insulin injection. Symptoms of this would be pallor, which means that the person appears very pale, sweating, increased heart rate or tachycardia, sleepy, or being very shaky. This is often seen with type 1 diabetes. Hyperglycemia is high blood sugar, and this is caused of insulin resistance, as mentioned before, with the body overproducing insulin. Diet and lifestyle can often occur with high blood sugar. Symptoms of this would be dry mouth, increased thirst, weakness, confusion, or nausea. Now that you have an overview of both diabetes and low and high blood sugar, I'd like to show you how to administer insulin if needed. With my volunteer coming up, I'm going to go ahead and show you this. Insulin cannot be given orally, meaning it has to be given with a syringe or as an injection. It is also a subcutaneous injection, meaning it's injected into the tissues, not the muscles. The most common places to administer insulin would be on the back of the arms, 2 inches away from the belly button so it can absorb correctly, or on the thighs. For demonstration purposes, I'm going to be using a pen as my insulin. If somebody is suffering from diabetic shock, the first thing you would want to do is pinch their arm. You would then take the syringe and inject it into the arm. You can then administer your medication, and when it's completed, pull it out and release the subcutaneous tissue. This is the best way for insulin to be absorbed within the body. Thank you to my volunteer. So as previously mentioned, according to the CDC, there's over 29 million people affected from diabetes, so it's extremely important to be educated and feel comfortable recognizing signs and symptoms as well as administering care if you can. More than likely, you're going to come across somebody who's suffering from this, so remember, you're always capable of providing assistance until first responders are able to arrive. Thank you for your time. my audience, and my note cards. Thank you.